My name is Arlene Rieger, and I am presenting this neonatal assessment for our neonatal 5110 course. This is Amy Anderson. She's our patient. She is 7 days old. We've gotten some history on her and asked mom some questions, and now we will proceed with the assessment. So first, you do a general observation of Amy. She is nice and calm, a little bit fussy when she cries. There is no asymmetry to her face. I don't notice any dysmorphic features to her face. She is nice and pink. She, again, is calm, and her limbs seem to be appropriate in length and symmetric to one another. So that's just general observation. Next, I go on to assess Amy's skin. Amy's skin looks warm. Amy's skin is pink, and it is warm and soft and dry to the touch. When I assess capillary refill, it is less than 3 seconds. I do tenting at the clavicle, that is also normal. I do another survey of her skin from head to toe and also her back. I don't notice any lesions or rashes or bruising or any trauma to the skin. I move on to her hair. Her hair is evenly distributed. There is no alopecia noted. Her hairline is not receded, and it is also not too far forward. Then I do her nails. I observe her nails and inspect her nails. Each digit has a nail bed, and that is appropriate and normal, along with each toe of her feet have a nail bed, and there's no trauma to the nails. There's a little bit of peeling, maybe some dryness to the nails, but that is appropriate. Then I move on to Amy's head. Her head is nice and round. There are no masses and no asymmetry to her head. It is appropriately sized at 35 centimeters. I palpate the anterior fontanelle. It is soft and flat. It is not depressed. Then I palpate her coronal sutures. Then I palpate her sagittal sutures. And then I palpate her anterior fontanelle. And those are all normal. I move on to her neck. Her neck is nice and soft and supple, no lymphedema to her neck, and it is a little bit short, but no webbing to her neck. Then I assess her sternomastoid muscles. They are even with one another. They are symmetrical. Both shoulders are even, so not one is higher than the other. Then I palpate the clavicles, and there is no crepitus found, so she doesn't appear to have any broken clavicles. And then I root out torticollis by turning her head, and she has perfect flexion to both sides of the head, so no torticollis found on Amy. After her head, I move on to her eyes, ears, nose, and throat. Her eyes are symmetrical. There is no drainage noted from her eyes, just upon observation. Her pupils appear appropriately sized, and they are also symmetrical. There is no drainage noted from her eye. If you draw an imaginary line from her eye to her ear, they are even with one another, and her ears are not both set. And so her eyes are normal. I will elicit the red reflex for her eyes. And so I'm going to shade Amy's eyes. I'm going to pretend to turn off the light to elicit that red reflex. And there it is on one side. And there it is on the other. And then in addition to that, I'm just going to test her pupillary reflex. And her pupillary reflex is equal and appropriate. Just take that apart. Okay, so those are her eyes. We went over her ears. They are noted to be symmetrical. There's no drainage from her ears. When I pulled down on the pinna, they bounce right back, so that's appropriate. Her nose is midline. Her nares are symmetrical to one another. I occlude one of her nares, and she can breathe comfortably to the other. And then I do that to the opposite side, and the same occurs. And then I occlude her mouth, and she can breathe comfortably to her nares, so there's no sign of choanal atresia. I elicit her cry reflex to look at the back of her mouth and her palate. Her uvula is normal. The palate is intact. There's no cleft lip. Her mouth is symmetrical. Her lips are symmetrical. The tongue is midline, and she's got a pink oral mucosa. And then I just palpate the top of the palate to make sure that it is intact, that I didn't miss anything, and it is. So those are her ears, mouth, nose, and throat. And let me just elicit, just pretending to, a little bit of the gag reflex, and she has the gag reflex, which is appropriate. So those are her ears, nose, and throat. I move on then to the chest area. Her chest area, as far as her respirations are concerned, she is breathing normally, comfortably. Her rib cage is symmetrical to one another. And I'm going to listen. You listen for the heart first and then the lungs. So on her heart is, I know S1 and S2 sounds. Heart rate is normal, regular rhythm, no murmurs noted. And then her lungs sound equally bilaterally. And she is under no respiratory distress. And she is not cyanotic. With regards to, so her lung assessment is normal. With regards to her heart, I just make sure to observe to the heart area to rule out any thrills or a precordium. And then I palpate for the apical impulse, which is at the level of the midclavicular line, second intercostal space, and it's appropriate for Amy. And like I said, her heart sounds did not reveal any murmur noted. There's also no masses to the chest or lung area or the heart area. With her heart, I'm going to palpate her pulses brachially and then femorally. And then I'm going to do a brachial and femoral pulsation to make sure there's no lag. They are +2 and normal at each site. Moving on to her abdomen. I just observed the abdomen. Her abdomen is noted to be round, which is normal. There are no masses protruding from her abdomen. She is not distended. She looks comfortable. And then I'm going to auscultate. And I note bowel sounds in all 4 quadrants. I'm going to just do a little bit of deep palpation to rule out any tenderness. There's no tenderness or masses upon palpation. And then I'm going to palpate 2 centimeters below the costal margin, and there's her liver, and it is normal. So that is her upper torso. Next, we're moving on to the genitourinary assessment. So I'm going to undo her diaper. I'm going to look at her labia majora, which is noted to be prominent. And then I'm just going to also rule out any clitoral megaly, which there's no clitoral megaly. Her clitoris is appropriately sized. And then I'm also going to palpate the anus and make sure that it is patent and no masses in the anus, and there are no masses found. I'm going to wash my hands and everything. Next, I move on to her musculoskeletal assessment. And in her musculoskeletal assessment, I'm going to look at her limbs to make sure that they are symmetrical to one another. I'm going to look at her tone. She's flexed at the elbows, hips, and knees. Her limbs are symmetrical. She's got flexion on both wrists, flexion at the elbows, flexion at the knees, and flexion down here in her toes. And her toes do not point outward or inward. They are appropriately, it's appropriate the way her toes are laying. And then in addition to that, her limbs are appropriately sized in ratio to her body. So they're not too long, not too short. When I look at her hands all have 5 fingers. Well, both her hands have 5 fingers. She does not have polydactyl or single dactyl noted, nor does she have polydactyl or single dactyl noted on her feet, nor is there overlapping of the toes. I'm going to turn Amy around. I'm going to check her spine, and there is no scoliosis noted, no sacral dimple noted either. So that completes, I believe, the musculoskeletal assessment. And next, I'm going to move on to her behavioral and neuro assessment. And so we just noticed Amy, and so the way she's behaving, and so far throughout the exam, she's been appropriately behaved and appropriately alert. I'm also going to test the side of her cheek for alertness. She does respond appropriately. I'm going to test her grasp reflex. It's appropriate. I'm going to test her postural tone and her moral reflex. So when I bring her back, her postural tone is appropriate, and then her moral reflex is equal and bilateral. I'm going to test her palmar reflexes, and they are appropriate, and her Babinski reflex as well. And then what I'm going to do, last but not least, is I'm going to do the Barlow and Ortolani maneuvers. So for Barlow, I'm going to adduct towards the midline and then push her thighs posteriorly. And then for Ortolani, there's no hip clipping or clicking, excuse me. And then for Ortolani, I'm going to bend at a 90-degree angle, her knees at a 90-degree angle, and then I'm going to adduct her hips. Abduct her hips, and I hear no clicking. And yeah, that's Amy's assessment. She appears to be a normal newborn.